Hello once again, readers. Mark Gentili here, the editor of Sudbury.com. We're back for another live chat with one of our elected officials for an update on how things are going in this ongoing fight against COVID-19 and this pandemic that we find ourselves in. I want to thank Sudbury MPP Jamie West for joining us here this afternoon on Sudbury.com. Mr. West, how are you today?
I'm good, Mark. How are you?
I am doing okay. We are coping. You must be a busy man. I assume you and your staff are fielding a lot of calls at times like these.
It's busy. It's interesting because we're not as busy, obviously, with social events, but the days are just as long and just as busy. And it's good. That's our job. That's our role as a constituency office to reach out to people in Sudbury, Coppercliff, have them reach out to us and offer advice and help where we can.
Mm-hmm. If you could sort of give us a picture of what sort of things people are calling you for, what kind of needs are people coming to your office and hoping that you might be able to help them with?
Well, a lot of those, it goes into two camps. So we get some calls from people who aren't clear on a government announcement and want some clarity. So they'll a good example would be that last month there was an announcement about help for students who are 12 years and under, that there'd be a one-time payout. And although that information was out and the statement was made, there wasn't any information about how to apply or where to apply online or in the government. And it's not to criticize, it sounds critical, but it's not to criticize, it's just that things are happening so fast, we're working so quickly. And so a lot of people are phoning to say, does it automatically come to me? Do they just go through records and send it out? Do we have to apply? Ultimately, what happened was on Monday there was a web portal where you could apply. So we get a lot of sort of questions about that. Where there's when the essential businesses were listed, people phoning saying, "Am I essential or am I not essential? I think I fit into this criteria, but I don't know about this criteria." And it's mainly people trying to do the right thing and looking for advice. The other part of the envelope that we get is people calling us who are falling between the gaps, who don't fit into one category or another, and aren't being helped by certain things, or who have advice about how, not necessarily themselves, but people they know could be helped with programs. And then I guess I said there was two, but there's three. And the third one really is a good news story. It's people phoning with ideas, about making masks, where we can get masks from other locations. Valet had donated a bunch of masks. Prior to that, people were saying, hey, what about Valet? They have PPE, they have things that we can reach out. So there's lots of good solutions and good suggestions that are coming out, which are also good, in just a reflection of the city. I say often that Sudbury's a community that cares, and we really do think about other people and care about other people.
Okay. I'd like to actually get into some, the ideas about caring for other people and where we're at with that sort of thing as we deal with the pandemic. But first, I just wanted, as an opposition member, I kind of was curious what for your impression of how Ontario is doing in combating this illness. What have we gotten right? I shouldn't say that. What has Ontario gotten right? What has the Conservative Party got right? What has Doug Ford got right? What have they maybe missed the mark on? Can you elaborate on that a little bit for us?
Yeah, I think if you go to the 10,000 foot level, one of the things that we're doing really well is that there is a real all hands on deck approach to this, that people are focused on this, and there's very little sort of partisan fighting or backbiting or cheap shots that you might have seen in another time of let me turn my phone off, I'm sorry.
That's okay, we don't mind a soundtrack.
I'll just put it on mute. I apologize for that.
No, I love live TV.
Yeah, so and this is all new, right? Like the way that we're collaborating, working, from home, that when there's votes that are happening, that we're organized so that people can, you get enough people to come to Queen's Park to do the vote. And the logistics of where you sit, there's a bunch of rules that are a little technical about where you sit and when you speak, but able to have the social distancing so that, legislation get passed. There's a lot of collaboration and working together on those issues, which I think are really good. I think another thing too is that when they released the list of essential businesses, there was a lot of frustration out there from different businesses that were listed or workers in those businesses, but in the community as well, where people were confused about, why dry cleaning or why a dog spa, and there might be a logical reason behind that. So, for example, say dry cleaning where it's to help healthcare, clothing, cleaning, that sort of thing. Maybe that makes sense. But there's a lot of sort of people wondering, how is this essential, not essential? And I think the government going back to look at it again, with suggestions that were brought forward from the other parties, I think that was a good decision as well. Overall, though, I think everyone has the message that collaboration is the right thing to do. Federally, municipally, provincially, people are working together, talking together, trying to follow each other's leads, trying to work together really well, and I think that's good. One of the things that I think all MPPs, but especially opposition MPPs, what's important is to bring forward the voices of people in your community, and it's important to do that in a way that's respectful and helpful. And so in terms of what did we get wrong, just a simple example is just prior to April 1st, there was a lot of stress from people in the community in terms of how will I pay my bills, my rent, my hydro, how will I get food, that sort of thing. And federally, there's money coming, about $2,000 coming, and what we had proposed was the province inject $2,000 immediately. And that took the stress out of people, because there's a lot of conversations about what do I do if I can't pay my rent? And that's difficult for the renter, but it's also difficult for the landlord. In larger communities like Toronto, your landlord might be a board of directors, but many of our landlords are what I call the mom and pop landlords, where they're concerned because this is their basement, or they own a duplex, they rent half out, and this is income for them, and they're worried about losing their income and not be able to pay their bills as well. And so our idea about injecting, the $2,000 into it allows people to buy groceries, pay their rent, that sort of thing, to make ends meet under these really difficult, unprecedented times.
Normally, if you wanted, as the opposition, if you wanted to press the government on an issue, you could do it in the House, you do it in the legislature, you could do it, Queen's Park, you could do it, you could somewhat do it through the media, and you could also do it in person, in Toronto, you could go to a minister, you could go to a member, you could, you could sort of press the point. What avenue as an opposition MPP do you have now to sort of try and put some pressure on the government, or at least some influence?
Yeah, a lot of people watch Question Period and they'll see the arguments going back and forth, but you have to keep in mind that Question Period is about an hour and a half of the day. There's a lot of work that happens outside of Question Period, in debate, which is not as aggressive and exciting for TV when you watch the debate, but also in the hallways or after Question Period, you'll cross the aisle to talk to people about issues that are coming up and concerns that are coming up, or ideas in your riding, that you're advocating for. You want to make sure that a certain minister has seen them and then approves of it, or is aware of it, So, one of my first conversations way back when I was first elected was I went and met with the Minister of Labor, and I said, as you're sorting through everything, you need to come to Laurentian University, you need to see CROSH, you need to see the Center for Research on Occupational Safety and Health, and the great things that they're doing, because this is something that you're going to want to brag about. This is something you need to know about, under your purview of safety under the labor hat. And so conversations like that happen all the time. What's happening now with, the world of Zoom meeting and FaceTime or phone calls and all these different technologies, it becomes slower and more difficult to have conversations, not just with ministers and members of the government and opposition. It's even with your own staff to coordinate. My staff are all working from home, so we're setting up a Microsoft team to work together. But for the time being, there's a lot of, calling each other, group text messages and stuff, which don't really slow things a lot, but they're slightly slower than before when you worked in the same office. You could say, hey, what's going on with this? Can I get a quick update? And email, while effective, you always have to think of the tone. And so it takes a lot longer to spell something out in an email than it would in a quick conversation face-to-face. And because we're in these really unprecedented times with the pandemic, our workload is so much larger. All the MPPs, not just saying, Sudbury locally or NDP or Liberal or Green or Conservative, everyone is so much more busy that the response times come a little bit slower. So that's one of the hurdles we jump over. What we're good at, though, is understanding that this is important, that this is the priority no matter what. And so there's a pretty good opportunity to respond and move things forward. Sometimes it's slower than you want. And especially for people who are involved with it, it's very, very slow. I think what's important to recognize is the government in general is much slower than this, right? And so in terms of being able to change things within a week or 2 weeks is unprecedentedly fast for government, And so, we do the best we can with reaching out, and we do the best we can with using the resources in our teams. As the labor critic, for example, we liaison with if we can't talk to the minister, with one of the minister's aides, someone in the department, to work back and forth, because the same as my role, I could not do my job if it wasn't for the staff that helps me. It's just there's too much work to be done. There's not enough hours in the day. And so it's utilizing our teams and making sure that our teams and their teams have a good working relationship.
Right. So are you sort of more focused on sort of helping constituents at the moment than in trying to wield some influence policy-wise?
Yeah. So there is a lot of focus on under my critic portfolio with labor, how labor is working, with the government and what's important with them. There was conversations recently about organizing or contract negotiations and how those are affected during the pandemic. It's not the same as it was even, I was going to say 6 months ago, but even 2 months ago. And so there's conversations about that, but those are smaller conversations. The main ones are about the constituents, the people who live in Sudbury and Coppercliff, in my case, for my riding. The conversations we're having, the challenges we're facing here, and overall policy has sort of fallen to the wayside in terms of what we were discussing, a month ago before we rose, just before March break. Those conversations are just sort of put on the back burner because the priority, like I said earlier, is what do we do to ensure people are safe? What do we do to ensure public safety right now? And that's sort of, and rightly so, that has sucked all the air out of the room and become our number one priority.
For sure. And I want to talk about that, actually. So frontline workers, we're talking about labor. As far as from your perspective, from what you're hearing on the ground, how are our frontline workers faring? Are they getting the support they need? Are they getting the equipment they need? Where are we at with that?
Yeah, let me, I want to talk about healthcare workers as well, but let me just quickly talk about, a lot of these workers in terms of retail and the stores that stay open right now. And so in these workplaces, there's a whole swing of how well protected they feel or what's going on. And a lot of that has to do with, one of the things I'm urging the Minister of Labor to do is to provide more input and feedback on how to be successful. So you can reach out to the public health unit. The public health unit has a couple articles that, I could link to Facebook or send you through email afterwards, Mark, that talk about, good standard practices. They have, you can contact Burgess Hawkins, my apologies. If you have a specific example that doesn't quite fit and you're looking for ideas, there's all good resources, but you have to know that they're there to get to them. And what I'm asking the minister to do is to send them out to the businesses, send them out to the chambers of commerce so they can, distribute them in the businesses, because there are people who want to do the right thing, but don't know where to start and what to do. The second part of it is that you need to recognize that you don't know everything. You need to speak with your employees to see the things that they're noticing that you're not noticing. And so there's that room for improvement, and there's a really high level of stress for people because of the pandemic. People are concerned about, what's safe and what's not safe. And I think it's important that as government, as the government and people in power and MPPs, that we talk to people about how can we help you through this? How can we help facilitate conversations? My background's in health and safety, so a safety conversation comes second nature to me. But I remember 20 years ago starting it, it's tough. It's tough. You sort of start with everyone's safe, right? And so these conversations we're having, there's places that do great work. When I look at, for example, at a grocery store, and they have people queued outside and they have markers showing, how far apart to stand, and they direct you which way to move through the aisles. I think that's really moving forward. There are some people who are working at this time who reach out to my office saying, how do we do it better? How do I move it forward? And it's a stressful time to have conversation with a supervisor. Most people feel a little intimidated having a conversation with a supervisor, and to have a place, because I believe a lot of supervisors feel safe about, having this conversation, want to have the improvement.
So
moving into healthcare, I think that the conversations, you're seeing it all the time on social media. People are bringing it up. There's communities that are banging pots and pans and putting up signs. Healthcare, retail, these people are heroes. The work that they're doing is so critical to everything that's happening here. The early days of the pandemic, when you think of the toilet paper disappearing from the aisles, and what could have happened. And now, we have a real sense of how things are working. There's some limits to some purchases, but, in terms of stock and being able to purchase stuff, we're doing a good job. When it comes to healthcare, there's a real stress for these workers. They know the work they're doing is so important. They know it's critical. And, there's this stress of what happens when they return home, that am I protected? Am I carrying anything home with myself? Am I affecting my family? And how do I care for that? A concern with that. I've heard from constituents who go into their garage, they strip in their garage, they try to decontaminate as much as possible, but there is some stress around that, and our hats off to people who are doing that and working through it, because it's something they need to recognize. The stress that, for example, we're feeling, where people are feeling stressed in the community about, if somebody coughs nearby or if I touch something, just imagine that, but your job really is to work with people who might be infected or people who have other illnesses and might, be infected and not know it. The other thing I'm hearing a lot about in healthcare is PPE shortages, concerns about shortages coming or concerns about having to use PPE and make it last for long periods. And when you're trying to protect yourself from infection, knowing that you don't have PPE or that you have to make sure your PPE lasts a certain amount of time, that can be very, very difficult for them. And then just finally, I know I've been talking for a while, but finally, the one thing I think is important we need to really emphasize is the personal support workers, the long-term care workers, really feeling left out of these conversations, that when we talk about healthcare, our minds tend to focus right over to the immediate frontline healthcare for people who are having difficulty breathing and having, showing signs and symptoms of this pandemic. But we have long-term care workers and personal support workers, developmental service workers who are working every day in people's homes or long-term care facilities, and often feel like they're left out of the conversations, that the decisions about where PPE goes to or the controls in place aren't being held with them as well. And so that's something we need to focus on the government. I know France Jelena, as our health critic, is doing a good job, has a great relationship with Minister Elliott, the health minister, to have those conversations and move them forward. But it is important that we're all aware of this, and again, it happens all the time with the congratulations and applause, but I'd like to echo again how important the work of healthcare workers, personal support workers, developmental service workers, and our retail sort of frontline workers are to keeping us going.
We'll be speaking with France Jelena tomorrow, so we'll dig a little bit deeper into the healthcare side of things. The government, as every day the premier is coming out and is talking about the fight to get more PPE shipments into Ontario and get those out to the people who need them. It sounds like it's a 24-hour a day kind of job working that side of it for the government.
Yeah. And there's some good news, success stories in Sudbury. There are people who are sewing masks that not the P95 mask, but just masks to help sort of limit what's expelled from your mouth. Sure. Putting those together. Chloe Arsenal is doing them, for example. Miss Tim Green Sudbury, she's making those a fundraiser that she's going to give money to Neo Kids, which is great. There's a lot of people using their 3D printers, at facilities like Laurentian, but also at home to help print parts for PPE that's being developed, which I think is great. It's great that people are helping when they can. It's
we've seen a lot of, as you said before, you're seeing a lot of bipartisanship. You're seeing communities come together on this. It's been quite the community response.
Yeah, no, it has been. It's really important.
Now, sort of more marginalized Ontarians, in situations like this, they are, there's certain demographics that often bear a heavier burden than perhaps others. In times like this, people with disabilities, Indigenous people, the homeless, and others, they often are harder hit in situations like this. How has the response been for them? Like for the government response for the more marginalized members of our community?
I think that it's important, and it's our role as opposition to make sure that these voices are elevated, and not that the government is choosing to ignore people, but just because the workload is so heavy and so much is coming in so quickly that it's easy to forget if people don't, sort of wave the flag or make some noise. When you think about marginalized people, so let's start at the very bottom rung of people who are homeless, people living with addictions, and the resources that they have. And these are the people that you might see downtown, you might see food banks and soup kitchens, and how we have to retool for that. And I have to give credit to the municipality. I mean, Sudbury City Council did a good job of working with the arena to have places where people can eat that are spaced apart. I know there were challenges more recently with washroom facilities and shower facilities that I think today actually the plan is moving forward. But it's difficult, right? Because you're tasked with such a big workload. And like you said, these people are marginalized. These people are typically forgotten. And so it's important that government at all levels do recognize who they are and where they are. You had mentioned Indigenous people and locally Indigenous people, all different walks of life, absolutely, but when I hear Indigenous people and the struggles with say, COVID or pandemics, I think of areas like Grassy Narrows where they haven't had clean drinking water for decades. How do you ensure that you're washing your hands and keeping yourself clean? Wash your hands as quickly as possible when you have mold in the buildings, when you don't have clean drinking water, when you have those issues like that, when you have housing concerns and so many people are in a certain area. Those are all things I have to work with. And that works as well with people who are underemployed, people with low income, or people who have suddenly lost their jobs and maybe haven't earned enough to qualify for the federal benefits, and really are looking at how will I make ends meet, how will I pay for things? And that's why our role as opposition to bring up ideas and to move things forward about this. We're in a time where people are all worried about secured employment, lost wages, and that sort of concern. And one of the things that really stood out to me, and really, I often see my role as amplifying the voices of the community. And so people reached out to me who are ODSP, disability, Ontario Works basically, but there's a bigger catchment if you're living with a disability. And the small wages that come through there, and I've been an advocate that ODSP have been too low for too long. It was cut, years ago, and it hasn't risen in time. And the raise that was supposed to come was cut in half. And the reality is that the majority of that goes to pay for rent, and it's difficult to get food. Now, when you look at people who are on ODSP and you have physical limitations and transportation issues, it brings a whole mess of more difficulties, because you're looking for bargains when you're shopping for food. You're looking for, you want to keep yourself safe, because many times you're more vulnerable due to your I was going to say respiratory, that's not what I meant though. Your ability to fight off infection might be compromised. And so now you're trying to figure out how to get to a grocery store, how to get for somewhere where there's a food bank, using public transit, or overcoming mobility issues, which all become more difficult. And I'm hoping that as we come out of this, right now we're basically, doing the best we can, solving problems as they come. But when we come out of this, I'm hoping that we reflect on this and we look at the amount of money that we give to people on OW, we give to people on ODSP, and what sort of struggle it is. And we know now that, with the federal CRB benefit, with the EI payments, those are actually higher than what we give out for OW and ODSP. And we know what a struggle it is for people to make ends meet with CRB and EI payments. And maybe that'll influence our decisions about how we fund OW and ODSP, sort of to help people, live with dignity and not worry about paying their bills and putting food on the table.
Right. The Premier in his has been giving these regular addresses every day to the province. Today, he talked about testing and ramping up testing to make sure that Ontario is doing the 13,000 tests a day that we are capable of doing in this province. One thing he said, though, he wanted to be sure that the first people being tested were people in long-term care homes. And I know that the NDP has called for some, Andrea Horvath, I think this week or late last week, put something out saying, that with a number of steps that she felt should be taken to protect residents of long-term care homes. Is enough being done to protect those residents? Are you glad to hear that the Premier is demanding that the elderly in homes be tested first? Is that the right response?
No, So the reality is in Ontario, we're doing the least amount of testing across all the provinces per capita. We have the capacity for about 13,000 tests. Our recent number was 3,000. April 1st, I think it was about 6,000. So the capacity has room to grow, and I'm glad the Premier's listening and saying we should be testing more people. And I do think that the priority should be in areas that are vulnerable. There was, I think it was in Bob Cajun, there was a long-term care home where several residents were affected, and as well as workers. And we really shouldn't have got to that stage. I sound critical. I'm not trying to be critical specifically of the government. I'm just being critical in terms of, in hindsight, what could we do better? And that's protect these most vulnerable people to the best of our ability. And I think testing does help with that as well. One of the concerns as well that we have, is with PPE distribution, is with, as I mentioned earlier, the long-term care workers and the PSW workers in those facilities, and access to PPE and controls. And as well as one of the issues that we have with home care is that people are going to multiple homes back and forth, and how do you ensure that transmission doesn't come from one home to the next in order to spread it? Ultimately, though, we do need to increase the testing. One of the things that concerns me, though, aside from the testing, because I think data is important and it drives good decision making, but as well, I think that sometimes people focus on the testing specifically, and what we can do individually is just limit the amount of testing that's required. So, and these are all basic things that we hear all the time about, social distance, or physical distancing is the word I prefer, because I know more people say social distancing, but, pick up the phone, go on Facebook, go on social media, send a letter, old school with a stamp on it, back and forth, but, reach out. So socially we're connecting with each other, but keep that physical distance. Wear a mask when you're out. It's not a requirement yet, but why not wear a mask just to lower the risk or the anxiety of retail workers or people who are walking nearby? Limit the amount of time that you're going outside, go outside for specific things. All these things that have been shared with us, these are all important so that, you don't get infected, you don't infect other people, and that limits the amount of testing that's needed so that it goes to those high priority areas that are so important to us.
Okay. When it comes to small and medium-sized businesses, you mentioned that that some business owners who wanted to provide some protective, sort of protection for their staff and for their customers weren't quite sure where to go. And I assume that you're happy to take calls from them and can to direct them to the information that they may need. But for there are a lot of small businesses who who have lost their income and still have bills that they have to pay. Is there enough being done in Ontario for small and medium-sized businesses? They kind of make the world go around in Sudbury and in a lot of other places.
Yeah. It's interesting because in Sudbury, when people talk about workplaces, the big ones come to mind, right? The universities, the colleges, the mining companies, but the reality is that it's these small, medium-sized businesses that employ the majority of people, not just in Sudbury, but across Ontario. And this is a very difficult time to be a small business. So many of these small businesses have been closed because of the emergency orders around essential businesses. And they still have bills to pay, and they still have they'll have rent, they'll have hydro, all these different orders. Especially if you're in a business that perhaps the stuff is perishable or needs to, isn't as good, a month or two from now. And so, we released recently the Save Main Street plan, and basically it's about injecting some money into these businesses so that they'll be there after the pandemic ends. So to begin, my hat is off to the amount of people that I see who have contacted me, or I've seen on social media saying messages of, I'm going to a local business, I'm going to a small business to help support them. Here's what I know about, I want to share with you, because I think that's so important. Just like our conversation about marginalized people, it's easy to forget the small businesses, right? It's when you're going for groceries, it's easy to remember the grocery stores and the Costco's. It's hard to remember maybe the smaller independent businesses that also sell food. Or when you're ordering a takeout from a restaurant, it's easy to remember the bigger chains than it is the small local ones. And so we need to remember the local ones and try to support them as much as we can. As a government, we really believe that our Save Main Street plan is going to help these businesses. And it offers support, for example, about 75% of commercial rent subsidies for 3 months. And it brings you up to about $10,000 a month. I don't know. I have no idea what the rental prices are. My job is to be a politician. I don't run a small business. So But that injection of money is going to really ease the burden on people who have put their sort of blood, sweat, and tears into starting their small business, running their small business,
Right.
the amount of employees they have, and really small businesses. I really love the environment they have, because these are the people who, they know their employees, they know their names and their kids and everything. And so when people are being laid off because of lack of work or because they had to close the door, they're feeling it so strongly because they care about their employees as well as they care about their business.
Right.
Basically, that's family at both ends. And so helping with the rent subsidy is going to help them survive, help ensure that there's jobs for employees to come back to after when we get back on our feet. Mm-hmm. I think another proposal we have has to do with freezing utility payments. And so, it'll create some stress because that bill continues to climb, but as well, it's a relief that you don't have to pay it today, that you can make, payments later on and maybe set up a payment plan once things are going on. But looking at your utility bill, especially if your business is closed, and thinking about paying for, hydro, paying for natural gas, whatever your utilities are, becomes very stressful as a business because no income is coming in. You know how tight the margins are and how difficult it's going to be. And this really is an unusual circumstance that's out of the control of the business owners. Right. And that's the role of government to step in and level the playing field and help them be successful. In terms of taxi cabs, we don't have Uber locally, but shared services, we're talking about, people being able to defer their insurance payments, and basically having an emergency fund to help businesses, survive. That they can tap into. This hasn't been accepted by the government. This is a proposal that we sent to the government now, so I don't get people excited asking how to get it. But if you're supportive, I'd love to see letters of support that I'll share with the minister and head forward.
Okay. What I have to ask,
talking about really is helping business be successful in these really unprecedented times.
These, it's great that to come out with proposals and things. What I wonder is, are you finding a receptive audience for them? It's very difficult to, what I was trying to get at earlier, it must be difficult as an opposition party to try and wield some influence when you can't actually physically, interact with anyone with decision makers that you need to get to. So, when is the NDP getting any traction on any of these proposals that the party is making?
So we've already had support from the Ontario Chamber of Commerce, who the president announced that he was supportive and thought it was the right direction to go in, which is very supportive. Each MPP, as well as reaching out to businesses for support. A term that we use is a validator. So you have an idea.
But what I mean, sorry, I don't mean to interrupt. But what I mean is sort of by decision makers, like, you need decision make. You need people in government to kind of buy into these, to the policies that you're proposing. I kind of wonder if you're getting any traction, in that regard, in getting, the ruling Conservative Party to take a look at these proposals, to take them seriously. That's kind of what I was wondering. Where are you getting traction in that regard?
In terms of that, Conservatives pride themselves on being the business party. I think all parties actually have pretty decent business plans, but I think they're.
I'm not just talking about business, though. I mean, any of these proposals that the NDP, like all of them, for long-term care, for business, any of those. Like, what kind of traction is the NDP getting from the government when you're making these proposals? Are you finding a receptive ear? Are any of these things potentially in the works? Can you provide any insight in that regard?
Yeah. So like any good politician, it depends. But being non-political about it, it depends on what the issue is. There are some that move forward. There is some traction. There is some where they're resistant and saying our plan is okay. I talked earlier about the $2,000 coming before April 1st, so people wouldn't be stressed about their end of the month payments. Obviously the government didn't agree with that and move forward. We agree to disagree and move on to the next challenge. I'm hoping on things like rent subsidy for people who are renting. More federally comes the mortgage deferrals, that sort of relief, and the small business package. We're hoping that they're more receptive to what's happening. Earlier I talked about the importance of helping business be successful, the ones who are running, and to have these sort of risk assessment plans in place to help people lower the risk of becoming infected. I think the government is receptive to that, but it's one of those things that you don't want to say yes or no until the final decision is made, because I don't want people watching to think that I'm promising stuff, and then when it doesn't happen, it feels like I pushed the government under the bus, or that I've made a promise that we couldn't keep. So it in some cases we do really well. In other cases we agree to disagree.
Okay, I have to say it's as a sort of an old reporter who's been sort of used to the cut and thrust of politics and used to the opposition parties banging their shields and that sort of thing. This kinder, friendlier, gentler relationship that seems to have grown up between the provinces and the federal government and the opposition parties and the ruling parties. It's sort of it's kind of odd to is it odd from your perspective to see this sort of there's this sort of quality of we're all in this together, I suppose.
Yeah, and this is something I think that people expect from government. We veered over the last decades into sort of a butting head. They say black, we say white party, and it was really amplified this year. Well, for me, being elected. Very difficult to move things forward or to suggest a way to make an idea better. A very simple example of that is that there was a bill, and I always screw up the order, but it was providing natural gas to rural, remote, northern Indigenous communities. And the bill was great, except that nowhere in the bill did it say that it would be used to provide natural gas into rural, remote, northern Indigenous communities. And I think 7 times I brought that up in debate, and it was brought up in amendments, and it was never put into the bill. And that was such a weird thing for me because I believe in collaboration. I believe in listening to people and improving ideas. And so that was weird. And I'm hopeful that this sort of new atmosphere continues after the pandemic. So we're forced into a position where we work together, but we really should be doing this all the time. It's sort of the goal of a lot of people see opposition as the person who complains all the time, but our role really is to take the bill or the law they're proposing and look for ways it can be even better. And that's what we're trying to do. And being able to listen and hear each other, I think, is important. It's hard, but it's important.
Yeah, there may be a sort of a honeymoon period, perhaps, after the pandemic is over, where it's holding hands and flowers for at least a little while.
Yeah, I mean, I think it's what people want. A really simple example this week, there was the fire ban. So a blanket fire ban came across, because the idea is you don't want to take your first responders and have them, fight a backyard fire or a forest fire somewhere. And it makes sense. And so local residents, constituents reached out and said, hey, what about people who make maple syrup? We have a wood fire, we have a cabin where we build it in. Some people are outside. Are there controls? Are there exceptions that can happen? And so that was something that resonated with France and I, and we reached out to the minister. The minister, France, actually, made contact with the minister before I was able to. But we had this exception made in, and there's a way for people to apply for that, and a way to ensure that it's a source of income for people. It's also a way for people to, as a family, stay together, not bringing in extras, but to stay isolated and stay busy so that the stress lowers. And it's an important sort of way of life, especially in the north, to have these sort of sugar shacks. And we were able to move that forward. And that conversation basically was reaching out to the minister and saying, you might have missed this part, and the minister going, yeah, that makes sense. How do we make a change? And that to me is how government should work. Ultimately, if he says no, we can't do it because of these reasons, that's also a possibility. But in this case, it was here's how we can improve it, and the minister was going, yeah, I think that makes sense.
Right. Maybe the pandemic is the cure for more civility in politics, perhaps.
It would be nice, because I really do believe that one of the most common questions I got after the election was, I watched Question Period. I don't know how you do that, because it's aggressive and it's yelling and jeering and stuff. And I think people want solutions. They want dialogue, they want conversation, even if it doesn't go the way they want. Ultimately, depending what side, if you're to the left or to the right or centrist, or you disagree with the outcome, I think people want a real wholesome discussion to make sure that they believe that the best decisions are being made.
Great. Well, MPP Jamie West, I want to thank you for joining us on Sudbury.com this afternoon to to give us your perspective on the issues concerning the pandemic. To our readers, tomorrow we will have Jamie's counterpart, Francelina, the MPP for Nickel Belt, on. We'll dig into, she's the health critic as well, so we'll dig into some more. We dug into a bit of labor with Jamie. We're going to dig into a bit of more healthcare with France. And as always, you can head to Sudbury.com any time of day. It's updated every hour from 7 to 10 p.m., 7 a.m. to 10 p.m. with new material, regular news as well as COVID-19 news. I want to thank MPP Jamie West for joining me this afternoon. For all of us here at Sudbury.com, I'm Mark Gentili. Wash your damn hands.
Thank you. Thank you very much.